Hello, my name is Dewash Jameson, and I am going to talk about diabetes and COVID-19 risk in Haitian Americans population. Haitian Americans are Americans who live a partial or full Haitian descent. They personally or their previous generations migrate into US from Haiti. The major of them lives in the urban center like Little Haiti, which is in Florida state. However, there are others who lives in different major cities. Most of the Haitian migrants moved to the U.S. in the mid 20th centuries. There is between the years 1957 and 1986 when the country was under a dictatorial regime. Most professional migrants to other countries currently there are about 1 million Haitian Americans, half of whom live in Florida. COVID-19 is the conditions that cause restrictions of lung cell and make it difficult for the patients to breathe. It is caused by a virus. It is believed to have emitted from a laboratory leak in Wuhan, China. After devastating the Chinese, it quickly spread to other parts of the world and became a global pandemic. In a bid to prevent its spread, people were forced to quarantine and abandon their job or leave some activities. About 7 million people lost their life due to COVID 19. However, vaccines have been developed which prevent the global society against the virus. Over time, it has mutated into different strains, but booster vaccines have been generated to half of its spread. Diabetes is a health disorder that entails an increase the level of sugar in the blood. Since the blood is pumped to every cells of the body, it's followed that the amount of sugar is generally high in the blood. It is caused either by the inability of the pancreas to generate insulin or the failure of the body to respond effectively to the generate insulin. Diabetes is an immensely common health condition. About 8% of the human populations are diabetic. It also account for the death of millions of people every year. Statistics show clearly that among the patients who were diagnosed with COVID-19, those who live with diabetes were adversely affected. In fact, in fact, um, diabetes COVID-19 patients lost their lives following the realization it was advisable that everyone lives with diabetes should quarantine more robustly to avoid contracting COVID-19. There is a chance that the high blood sugar level among diabetes patients encourage the progression of COVID-19 virus and enhance the destructions of lung cells. Patients who did not properly manage the diabetes were found to be more adversely affected with COVID 19 than those who managed their illness. The Haitian American who lives with diabetes for generations to a large extent died after after they were infected with COVID-19. Since they were low class citizen, they had limited money to effectively manage the diabetes. In turns, once they contract COVID-19, it had a worse effect on their lives compared to white Americans who were also diabetic. A large number of populations lost their lives in the years 2019 and 2020 at the higher of the COVID-19 pandemic. The cardinal symptom is the one that leads to weight loss that is unwarranted. The patient is incapable of absorbing sugar from the blood to the body cells. Hence, the body becomes lean whilst the blood contain, while the blood is contain high level of sugar. Another symptom is heightened urination frequency. The sugar is passed to the urine and it draws most of the fluid from the body tissue into the bladder. Diabetes also leads to higher thirst. There are other signs that may be related to diabetes, but they tend to be a subtitle in most cases. They include fatigue, blurry visions, itching skin, headache, and slow healing rate for cuts. So, with the progressions of diabetes in the body, the patient's visions gradually diminish. Eventually, one may end up in total blindness. The condition is known as retinopathy. Another complications associated with diabetes is damage to the kidney. The tissue can scare and in extreme conditions completely become dysfunctional at the end of the day. The patients require a kidney transplant. Neuropathy, which is damage to the nerve, is another complications of diabetes. It subject one to signs such as numbers, weakness, and muscle pain. It may eventually require amputation as the only remedies. There are two types of diabetes. Type 1. Diabetes is caused by the damage of the cells in the pancreas which produce insulin. And the type 2 is diabetes caused by resistance to insulin. Once the body resists insulin, it cannot absorb blood sugar and in turn, one become diabetic. Gestational diabetes occur in approximately 5% of all pregnant women. It is treatable. It is treatable if defect detected. If detected, it may also reduce or fully disappear after pregnancy. However, about 5% of women with gestational pregnancies remains diabetic even after delivery. Another type of diabetes is MODY. It is caused by gene mutation. It is, however, very rare. A positive diagnosis of diabetes is subject to a confirmation using a number of positive tests. One of the tests is known as the fasting level of plasma glucose. It is taken in the morning right before the patient take breakfast, and it is presumed that they fasted overnight. The level of expected to be below 7 mmol per liter. Another test is the plasma glucose. It is expected to be 11.1 mmol per liter. After an oral load of glucose to the tunes of 75 grams, glycate hemoglobin is another test that can be used to detect diabetes. It is expected to be less than 48 mmol per moles, which is mol. Currently, there is no viable preventive measure that has been deduced for preventing the construction of type 1's diabetes. However, for the case of type 2, maintenance of blood weight at a normal level is an effective preventive mechanism. One also needs to keep their body physically fit by undertaking exercises. Eating healthy food is also an added advantage. When one takes a diet that have high level of fiber, whole grain, and minimal fat, they reduce their risk for diabetes. The one who diagnosed with diabetes needs to be aware of the conditions and learn how to live with it. They should have a number of lifestyle changes besides conforming to the prescribed medication. Since diabetes is the increase in blood sugar levels, one needs to be cautious of what they eat. They should reduce sugar consumption. One also to avoid activities such as smoking. It is imperative that they learn how to inject themselves with insulin, especially when it's necessary. In some cases, the patient is supposed to undergo dialysis on a regular basis and have it as part of their lifestyle. There are a range of drug which medicinal value which are prescribed for patients with diabetes. They are meant to improve the quality of life and reduce the affinity of complications emerging. The most common form of the treatment that the patients receive is conjunctions of insulin. It is so common that some patients have to inject themselves at home. There are also other drugs such as metformin, which has been proven to reduce mortality rate. In the entire world, there are roughly 425 million people living with diabetes. The rate has almost doubled since 1980. In that regard, about 1.5 million people die of diabetes each year. Approximately 1 in every 12 Haitian Americans live with diabetes. Unfortunately, almost all Haitian Americans who contract COVID-19 and live with diabetes perished. In fact, that most people living with diabetes die once they contracted COVID 19 led to a scenario where there were the high death rate and a reduction in the populations of this demographic group. As a result, the community was plunged into a poverty. There was an increased rate of crime in the community. Some people resort to crimes to pay their bills. It also led to an increase in immoral behavior such as prostitution and abortion. The government institutes a number of programs such as financial aid to members of the community which help in mitigating the challenges. The local community also conduct programs such as adoptions of orphans or counseling of the depressed, which has been instrumental in solving the problem. The international community has also offered remedy in the form of exporting requisite PPEs. Technology has been instrumental in enhancing education and counseling on global level. Lastly, religion has been employed in ensuring that all stakeholders find peace in hope. There is an apparent relationship between COVID 19 mortality rates and diabetes. COVID 19 patients who have diabetes has one of the comorbidities and tend to die much faster in comparison to other infected patients. Indeed, one live with diabetes can manage the conditions and lives longer. It is a common condition and a large segment of populations lives with it. However, those living with the conditions are at a higher risk of dying once they contract COVID 19. Haitian Americans are largely middle and low class Americans. They cannot afford to manage the diabetes effectively, which lead to the high mortality rate once they contract COVID 19.